Vagus nerve stimulation overview. What is vagus nerve stimulation? A type of neuromodulation that alters nerve activity. Involves implanting a device to send mild electrical pulses to the brainstem. The electrical charge is discharged to different brain areas, altering brain cell function. Also known as a pacemaker for the heart. Limited to individuals with treatment-resistant epilepsy or depression. Approved as a rehabilitation aid for stroke survivors. Vagus nerve functions. One of 12 pairs of cranial nerves that send electrical signals between the brain and various body parts. Longest cranial nerve X, 10, starting at the brainstem and passing through the neck to chest and abdomen. Part of a circuit linking the neck, heart, lungs, and abdomen to the brain. Vagus nerve stimulation involves using a device to stimulate the vagus nerve with electrical impulses. The vagus nerve runs from the lower part of the brain to the chest and stomach, causing electrical impulses to travel to areas of the brain. Devices like implantable vagus nerve stimulators have been approved by the FDA to treat epilepsy and depression. Devices are surgically implanted under the chest skin, causing electrical signals to be sent along the left vagus nerve to the brainstem. Non-invasive devices have also been approved to treat cluster headaches and migraines. Current research is exploring the potential benefits of vagus nerve stimulation for rheumatoid arthritis, inflammatory bowel disease, bipolar disorder, obesity, and Alzheimer's disease. Vagus nerve stimulation is considered for people with focal epilepsy, depression, and stroke recovery. The FDA has approved vagus nerve stimulation for adults with long-lasting, hard-to-treat depression, known as treatment-resistant depression. When combined with rehabilitation, vagus nerve stimulation can help people recover function in their hands and arms after an ischemic stroke. Vagus nerve stimulator implantation risks and preparation. Surgery risks. Rare but similar to other surgical complications. Pain, infection, difficulty swallowing, and vocal cord paralysis. Temporary but can be permanent. Post-surgery side effects. Voice changes, throat pain, cough, headaches, shortness of breath, trouble swallowing, skin tingling, trouble sleeping, and worsening sleep apnea. Most side effects are tolerable and typically lessen over time. Adjusting electrical impulses can help minimize these effects. Preparation. Consider the pros and cons of implanted vagus nerve stimulation before the procedure. Consult with your healthcare provider about other treatment options. Consider stopping certain medicines and eating for a certain number of hours before the procedure. Expect a physical exam and antibiotics before surgery. Procedure. Surgery is usually outpatient, with general anesthesia. 2 incisions are made, one on the chest and the other on the left side of the neck. The pulse generator is implanted in the upper left side of the chest. A lead wire is connected to the pulse generator and attached to the left vagus nerve. The device and its battery last for many years before being exchanged for a new one. Post-procedure vagus nerve stimulation for epilepsy and depression. The device implanted for epilepsy or depression is programmed to deliver electrical impulses to the vagus nerve. Stimulation starts at a low level and gradually increases based on symptoms and side effects. The device can be turned on and off in cycles, with potential side effects including tingling sensations, neck pain, and hoarse voice. Newer models also stimulate the nerve when there's a rapid increase in heart rate, indicating a seizure. The device can be turned on at different times using a handheld magnet. The device is typically turned on by a specialist during rehabilitation or at home using a magnet. Regular visits to the healthcare provider are necessary to ensure the device is functioning correctly and not shifted out of position. Vagus nerve stimulation is not a cure and may not significantly reduce seizures or shorten recovery time after a seizure. Improvements in mood and quality of life may be experienced. Research on the benefits of vagus nerve stimulation for depression is ongoing. Studies show that vagus nerve stimulation paired with rehabilitation can improve function in stroke patients and those with thinking and swallowing problems. More research is needed for conditions like Alzheimer's disease, rheumatoid arthritis, inflammatory bowel conditions, and heart failure.